We promised we were going to teach you how to do a full immersion fever bath, and now we are in the hydrotherapy center. We have Christopher in the bathtub here standing by, and we're going to demonstrate how to do a full immersion fever therapy bath and to be able to do it safely so that we don't have to fear that we might hurt somebody. Hydrotherapy generally is a very safe presentation, a very safe type of therapy to work with. But there are some cautions, there are some safeguards. We want to be able to do it intelligently. We don't want to make any mistakes. And I want to share the principles and the practical protocols so that we don't make any mistakes and we don't hurt somebody. Now Christopher is sitting in a tub of very hot water, and we're going to have Christopher now shortly go ahead and totally submerge himself right up to his neck. If you can just lean back and maybe get closer to the front there. Now, okay, that's perfect. You maybe want to come just a little bit closer because we're going to be here a little while and I don't want you to get your neck tired. So right about there might be fine. You can go down just a tiny if you wanted to. Are you going to have to hold yourself in place? Okay. We've got a thermometer in his mouth. We want to know what his basal temperature or his regular starting temperature is, because I want to know how many degrees I'm actually raising Christopher up. I don't know how many degrees to take him up if I don't know where I'm starting from. So I want to know before I get started if he is actually a person who fits the quote-unquote normal profile of 98.6, or perhaps if he's like me who runs about 1.5 degrees low, or if he's someone who runs a 0.5 degree high. 98.6 is only sort of a standardized average of most people, and not everybody totally fits that profile. If you have someone who runs about 2 degrees low all of the time, and you take that person up to the same level that you would take someone who runs 1 degree high, you're not getting the same effect. And so we're looking at those factors before we actually begin. In addition, I want, if you'll put your hand out for me, Christopher, I want to take Christopher's pulse. And I want to know whether Christopher is dealing with the heat in a satisfactory manner, or if we're going to have problems along the way somewhere where he's actually going to start to get a more rapid pulse rate than what I'm comfortable with. And again, with the other type of therapy that we were talking about earlier, we have our formula. We have 220 minus the patient's age. Multiply that product times 0.75 to give us 75%. And we're not going to worry if his pulse rate stays under this. If he's a very healthy person and he doesn't have a history of heart disease in his family and has not had any physical manifestations earlier in his life, I might even let it bump over that just a little bit as long as he seems like he's doing okay. Okay, his pulse rate is just fine. We're not having any problems with that, and we're ready to begin our procedure. Now, one thing that I want to talk about is preparatory to this procedure. Many of our patients throughout the procedure are going to tell me, "Oh, I'm so thirsty. This is so hot. It's so thirsty. Please, can I have a drink?" Before you start your procedure, ideally about a half an hour before, give them a lot to drink. Now, you don't want to do this on a full stomach. You don't want this person to be trying to digest a 3-course meal while they're in this tub of hot water, because you're going to have them having some problems. Their digestion's not going to work right. They may actually get very sick to their stomach or something on you. You wanted to have it a couple hours after their meal, preferably. And that's our case with Christopher. We don't have a 3-course meal in his tummy. Everything's ready. We've rehydrated him. I mean, he's had like 3 big glasses of water within the last half hour, so he's not going to get real overly thirsty on me. And we're all ready for clear sailing to start in with the fever treatment. I want to take his temperature again and see where we're at. Okay, we're right on the money there. In fact, he's raised up just a 0.5 degree, and we're well under our way to actually beginning to elevate his fever. The reason we want to elevate the fever is if Christopher has a cold or a flu or a bacterial or a viral infection, or perhaps he has a rundown immune system, and we just plain want to deal with bringing his immune response up to where it should be. We'll have him in this bath, and that's going to stimulate his immune system. If he has any bacterial or viral infections going on in his body, the heat from this fever bath will discourage these organisms from being able to stay alive. And if they're dead, then our system can deal with them and get them out, and he'll begin to feel better very soon. Okay, everything's going okay? Okay. Now I've got a glass of water over here, you'll notice on the side of the tub, that if we really get down there and he begins to wish he had a glass of water, if his temperature has come up to the level that I'm headed for, and typically in most patients we're going to be looking somewhere around 103 degrees Fahrenheit, and we're going to want to keep it there for about 30 minutes or maybe a little bit longer. If he had a severe case of an infection or a really bad flu, I might want to bring him up a little higher, maybe even up to 104 degrees. But the higher that I raise his temperature, the more that I'm going to have to safeguard keeping his head and his neck cool. If I knew that his body temp was up where I was comfortable with it and he wasn't elevating and he wasn't dipping down, I'd probably be comfortable with giving him a glass of water, and at that point, when he begins to sip water, we may as well abandon the thermometer because it's not going to give us valid readings excuse me, anymore. All right, we're comfortable with the pulse, we're comfortable with where his temperature is at. The tub temp is important. I want to start out with water in this tub at somewhere between 107 and 110 degrees Fahrenheit. The hotter he can take it, the better. Why? Because if you start out with a cooler temp, his body will try to regulate against it and not let his fever actually begin to rise. If it's hot, and especially hotter, closer to the 110, maybe even 111 degree Fahrenheit range, then he'll have an opportunity of spiking his temp right away, which means his fever treatment will last a lot shorter duration than otherwise, and we'll be able to get him out of here in a much quicker order, which is less stressful and less fatiguing on the patient. Okay, to keep him cool, you want a nice bucket or tub of very, very cold water, and in many cases I like to even have ice in this water, because when he begins to get very hot, he's going to want to be kept cool. I don't want his brain or his head to get too warm, because then he's going to start having even potential brain damage. Now this is nice cold towel that we're wrapping around his neck. It's on the back of his spine. And we're going to get another one. And I'm wringing these out so that they're a little bit drippy. These are not dry, they're not just soaking wet, but they're a little bit drippy. You're going to get a drip here and there. Now, depending on your patient, I like to actually just cradle that around his head. He's just going to look like he's a shepherd in the nativity scene here. Yeah, I've got cool wrapped all the way around his head. A typical patient is going to begin to protest a little ways into the procedure that they're just too hot no matter what you do. So you're going to constantly be changing this towel around the neck, this towel on the head, and it's nice to have two attendants, because one of you can be wringing out the towels for the other one and maybe taking the pulse, because you want to be rechecking the pulse every 5 minutes. And I may just begin to mop his brow and keeping him from getting too overheated. Now I want to check his temp. Oh, we're doing really well. We really got him up there. You know, some people, their systems are so stubborn that they will not raise their body temp up. But with Christopher, he's got a very cooperative body system, and he is really cooperating. His temp is rising rapidly. I wish that I had a system like that, because for the times that I've had to be in his position, my body has resisted stubbornly, and my fever treatments take a long time before my body will actually relent and allow the body temperature to come up. Okay, I want to take your pulse again, because we don't want to let things get out of hand. I'm using the method where I will use 15 seconds, take my pulse rate and multiply by 4, and he's doing just fine. He's up a few beats over what he was before we put him in, but nothing really terribly significant. Okay, it's time that I want to change. And this will keep you relatively busy. I want to share the contraindications for a full immersion fever bath. We would not use this particular treatment on someone who has severe hypertension. And ideally, if you have any reason to suspect that you may have a person who has hypertension or even hypotension, it would be ideal to take a blood pressure reading on this person before we begin the treatment. And you definitely want to ask a lot of questions. You know, do you have heart disease in your family? Do you have heart disease? Have you ever suffered from heart disease? Have you ever had your pulse, you know, do you have rapid runaway pulse rates, or, you know, these types of things that you want to ask. You know, you don't want to say, do you suffer from arrhythmia or tachycardia, because most people are not going to know what you're asking about. So just put it in terms that they're going to understand. We're going to keep him cool. Check his rate again. See where he's doing. Okay, we've got him up to where we want to keep him. If he were being a little hard to keep up with the temp, I would add some hot water. If he goes too high, I may want to cool him down just a little bit, but that's really rare. It's usually I have to add a little periodically. If he is dizzy or has a severe headache, we wouldn't want to use this type of therapy unless we were advised to do so by his physician. Those are some of the contraindications. You don't want to put somebody who's very weak or very, very debilitated into this type of therapy, because it's very taxing on the system, and they're going to have a little bit of a problem dealing with that. Somebody who has had recently in their medical history had a heat stroke may not tolerate this very well, and you may want to use a different therapy. You may want to use the non-immersion method, or you may even want to just use a steam bath instead. Okay, I want to hold this temp with him. We've got him up to about 103, 103 and a half. That's as high as we want to go. And we want to hold this temp about 30 minutes. Now, for the sake of this presentation, and so that we aren't redundant and wear you as the viewer out watching this procedure, we're going to shorten this down, and we're going to wrap it up fairly quickly, just so that we can keep your attention span and get the material in as well. But 30 minutes is about the cutoff time that's normal for almost every type of a treatment. If it's a very severe infection or something, we might hold it longer. If he had a case of one of the more severe flus or something, we might hold it a little bit longer. But typically, I'm happy with 30 minutes if we can maintain it for that long. Now, for the sake of this presentation, let's say that we've reached our 30 minutes. And now I want to cool him down. I didn't have a problem where I had a runaway pulse, or he was too rapid and I felt like I needed to bail out. Had I felt like I needed to bail out, I at that point would have begun immediately to go into the cool down phase. Now, what do I mean by the cool down phase? Cool down phase is a period where we begin to gradually, over a course of about 10 to 12 minutes, drop his body temperature down several degrees to where we've got him no higher than 100 to 101, somewhere in that range. And I really like to deal with it within right around 100 or 99 to bring him down that far. And it doesn't take very long. What we're going to do is we're going to reach over and we're going to begin to let some water out of the tub. And in addition to letting some water out of the tub, I'm going to begin to put in a little bit of cool water. Now, I'm going to have to pull up my sleeve just a little bit so that I'm going to have to unbutton my sleeve to get in there, aren't I? Okay. Our tub is draining slowly. Okay. And we're going to start to run a little bit of cool water in as well. Now I don't want it to all just focus on his feet. So I'm going to do the mixing. Christopher's tired. He's really worn out from this, and he's really had a hard time with this. I'm going to begin to cool him down. Now, I'm going to want to cool his head down as well. He's a very cooperative patient. He's a very strong patient. Most people begin to complain that they're too hot. If you have a person who complains a lot about too hot, then you're going to want to cover the back of their head with a little bit larger towel than what I'm utilizing there. The name of this game is to prevent cooked brains. We don't want cooked brains, okay? Okay, we're dropping the temperature of the bathtub water. We're actually going to drop the temperature probably 15 to 20 degrees before we're all done, but maybe even not even quite that much. Now what I want to do is I want to see what's happening to Christopher. Okay, we're slowly inching down, but not very fast. This may take, in reality, usually about 10, 12, maybe even 15 minutes. But we're taking the edge off of the heat in the tub. He's no longer beginning to feel, typically a patient is going to be going, I'm hot, I really want to get out of here. They have an anxious state of being. This immediately begins to remove that anxious feeling that most patients will have, and it's a normal response. It's a little more hot than it is comfortable. And I'll continue to mix. While I'm mixing, we're going to mop his brow a little more. And one thing I want you to realize is, because this is a presentation where I'm having to share and to teach, and I'm the only one doing this, I am not changing and cooling his head as frequently as I normally would if I were really dealing with the patient. I normally would have either myself or another person changing these towels maybe about twice as often as what we're talking about right now. We're continuing to drop the temperature of the tub down. Okay, he's come down. We've got him down to where he's just right around 100 degrees. And at this point, I feel pretty comfortable at deciding that we're going to get Christopher out. Now, how are we going to finish this? Because we can't leave him at 100 degrees, and we can't just take him out and dry him off and put him back to work again. We want to deal with him in a safe fashion. Now, we've removed the shower curtain for this procedure so that you can see what we're going to do. Okay, I want to get the thermometer out of his mouth, because I've seen people in this phase drop them before. And we're going to take off the wrappings off of his head. And we're getting ready at this moment to go ahead and stand Christopher up. Now, I don't want to ask Christopher, please stand up. I'm going to help Christopher stand up. He's been in this tub approximately 40, maybe 45 to 50 minutes from the time that we initially put him in to begin to raise his body temp to the time that we go through 30 minutes of sitting in there at a prescribed temperature. And then we're talking 10 to 15 minutes of cool down to where we're in a comfortable temperature. He's been here a while and he's really had it. So I'm going to help him up. Okay, how do you feel? You okay? You're not dizzy? Okay. Some people are going to be really dizzy and they're going to have a real problem. Now, because we've removed the shower curtain here, we can't do the one phase that I normally would do, and I would actually turn this water on. And I would start out with not hot, not cold, just a tiny bit cooler than what he's been in there. and then edge towards the cold until I've actually got cool water pouring all over him. I'd have him turn around about 3 times in the cold water as it pours down on him, and I'd ask him how he's doing. Sometimes they get dizzy at this point. Sometimes they tell us, oh, my stomach is beginning to feel a little bit queasy. But usually at this point, they're really beginning to feel pretty good about being out of the hot water. Now what we want to do, we've had him in the cold, we're ready to dry him off. And for the sake of modesty for the program, we've got a t-shirt and a pair of cutoffs on him. The most you'd want to have would be like a swimming suit or underwear, preferably for medical use, nothing. And that's why we're going to have men working with men and women working with women as medical missionaries, because we want to dry him off rapidly from head to toe. We'd have Christopher step over the edge after we've dried what we can get at there. We're going to have him come right over the top, and I'm going to have him sit down, and now I'm going to finish drying him off on the lower part of his body. You dry the top first, you bring him out, have him sit down, and then we're going to dry him off on the bottom. At this point, we've had him up, we've kept him at his plateau, we've cooled him down, we've sprayed him with the cold water, he has had his pores closed, he's had a shock to the immune system to stimulate it, and he's dry, and what we want to do now is put him to bed. 30 minutes of rest before we let him do anything else. Keep him well covered, let him sleep. A lot of people will come out of this very groggy and ready to sleep, and they'll knock off for an hour, maybe 2 hours. When you get them up, feel of their skin, make certain that they're not cold or clammy or sticky. You don't want their pores to be open, you don't want them perspiring. And if they are, you may want to take a cool, damp, wet cloth, just rub it over their body and close all their pores up, dry them off, and then you're ready to turn them loose and let them do what they're going to do. I like to do this in the evening so that we can finish the procedure and then just put them to bed for the night. And that's all there is to it. It's very simple, it's easy. It's nice to have a big bathtub like this. If you don't have a big bathtub like this and you have to use a smaller one, you may want to cover your patient with a blanket or another shower curtain or a piece of plastic and a blanket, so that when their knees and their upper body stick out of these smaller tubs that we find in some houses, especially in mobile homes, that you actually can get them warm. The more the body that is out of the water, the less opportunity that you're going to have to keep their body warm. So I would say if you have a problem where you realize that you're going to have a lot of the body of your patients out of the water, before you actually put the water in the tub, take a piece of plastic and tape it along the edge over here, and then just drape that over your patient after your water is in the tub, and that will hold a lot of the heat down. If you just put a blanket directly over them, as I've seen tried many times, the blanket gets wet and it begins to evaporate and actually cools the patient more than it would actually hold the heat in. That's all there is, and I hope that you can be able to utilize this procedure safely and that you'll have good results with it.